Fertility treatments like IVF can cost thousands of dollars, as we know, and are not necessarily covered by the government or an employer. But there is a need for care now more than ever with look at this number, with 1 in 6 people worldwide experiencing infertility. Dr. Marjorie Dixon is the founder, CEO, and medical director of Anova Fertility. She joins us this morning. Good to have you here this morning.
Thank you for having me.
So you started Anova, back in 2016?
Yes.
After being an IVF patient yourself.
Yeah.
What was it about your experience that made you go, no, I've got to do this myself?
I am an eternal idealist, and I consider myself an empathetic sage. So as a physician, I knew what kind of care I would want to be receiving, and it wasn't necessarily the care that I received. So I was at that juncture, like, I need to do something different. I want to create something by a Canadian for Canadians that's world-class care, but also recognized all patients. And so I recognized that there was some disparity and inequities because the patients that were coming to care didn't look like me. And a lot of patients were saying, I wanted to see a fertility specialist, but nobody referred me in a timely way. I wanted to see a fertility specialist, but they told me I didn't have to see them. And then when I got there, the care was so expensive, I just couldn't get to care. And so I related to patients, and I'm like, I can do better, and I can provide for Canadians in an equitable way and bring more people. Everybody deserves the right to a family, and that's what we tried to do at Anova.
So what are some of the fertility care services that, Anova offers?
Anova offers, well, pretty much everything. So we're everything under one roof. And that means that we do from IUIs, assessment, fertility assessments, egg freezing, all the way up to the higher, fancier assisted reproductive technologies. That means IVF, in vitro fertilization, literally where we stimulate someone, retrieve eggs, combine them with sperm in a petri dish, and grow them in a very fancy embryology lab, and then return them to a uterus to grow a baby.
Fancy sounds expensive.
It can be, well, because it's not making widgets, it is creating life. And sometimes in the face of tremendous barriers medically, because it's 1 in 6 couples, and there are a lot of things, gynecologically can be a problem, male factor can be a problem, it's 50-50, essentially sometimes it's female factor, sometimes it's male factor.
That's good to point out too.
Yes, yeah, equal opportunity, I call it. And then, you have a laboratory. If you're bringing in best-in-class technology, Anova's committed to non-complacency and continued innovations and improvements in the lab to provide Canadians with world-class fertility care. But that costs money.
Of course.
And so helping to bridge that gap, we don't have to reinvent the wheel. We look to other jurisdictions that have well-resourced for healthcare systems. And that's like the US, like the UK. And how do they do it? They do it with funding programs. Right. And so funding, and then also employer benefits. So these are the things that I've been a big proponent and patient advocate because I was a patient. And the first time I had IVF, I was a fellow. So I was still working. And I joke that my first child should be named Visa because that's how I funded him.
That's how you funded him.
Yeah, his name is Nathaniel.
Yes, middle name is not Visa. Let's talk about access.
Yeah.
Because a 2022 study showed that less than half of Canada's health ministry leaders are women. Less than 7% were racialized. How can we change this statistic and continue the conversation around the importance of having diversity among healthcare leaders?
Wow, in 30 seconds or less. But ultimately speaking, we have to acknowledge that there's a gap. We have to address the gap that exists. And that means doing things in healthcare that can promote diversity and equity in medical training, and including things that help to bring women of minorities. So even if I think of Anova, when I think about the world-class team of doctors that we have, we are racially diverse. So we want our patients to be able to see themselves because then they'll come to care. They'll be willing, they will be more compliant. They will also get better outcomes with the care that they get. And I would say that right now, as we're going to an election, we talk about the Conservative Party including fertility care in their platform. They're actually committed 3 times the original funding that they were committing in 2015 when I started. There was a $50 million investment by the provincial government. Now, the Ford Conservatives committed 3 times that so that we can get more people and that we can level the playing field so that everybody, regardless of their race, their identity, their gender, their geography, their sexual orientation, they can actually get to care in an equitable way through funding and with lots of healthcare providers that look like them.
It is great to have you here. Dr. Marjorie Dixon, thank you for joining us this morning.
Thank you for having me.
It's really